Good morning, sir.
Good morning.
How are you feeling today?
Fine.
Can I know your name, sir?
Dr. Ajith Cherian.
And you're here with?
I'm working in Sujit Rajana Hospital. I'm from Trivandrum, Kerala.
All the way from Kerala to attend the awareness camp that we have here. Okay, so first question I would like to ask you here is that why is it important to aware people on epilepsy?
Actually, there's a treatment gap. What I mean by treatment gap is that if you have 100 patients with epilepsy, less than 60 will definitely come to a doctor. The initial 40% may not even approach a doctor. And of the 60, another 30 may not get the right treatment because they may be treated by physicians, Ayurvedic practitioners, Siddha, Unani, this kind of stuff. And they may not get the real effect or the drug that is required for managing their epilepsy. So there's a huge treatment gap as far as epilepsy is concerned in India.
And also to those who haven't taken an advice from a doctor professionally, what do you want to say to them? Why is it important and why should they be going to the doctor?
This is an eminently treatable condition because if you look at the management of epilepsy, 80 to 85% are well managed or well treated with drugs. So it's just the less than 10 to 15% who will require something like surgery. So, it's most important that you get a professional trained help from a neurologist or better from an epileptologist. So that will go a long way in getting the disease because the longer the disease takes place, the harder is for you to break the network and it will be difficult to get it done. So we get patients after a long time being handled by physicians or pediatricians across. By that time, the refractoriness sort of sets in. So it's always better to approach a good neurologist or an epileptologist as early as possible.
Also, sir, I would also like to ask you for those who are already suffering from it, they also might tend to have a depressive feeling all the time. Since they are not so used to of having seizures in a such an environment where it is not family but colleagues, friends, or a public place. For such embarrassment, they tend to have depression or feelings like that. For that, what are you supposed to say to them?
This is a disease which is still associated with stigma. If you have a black mole on your face, on the most obnoxious part, how will you feel? You won't feel good. You will be slightly depressed. Any teenager will feel depressed about it. So just imagine that you're having a disease like epilepsy. The stigma associated with epilepsy is very bad in India. And they may not be able to take part in activities like cycling, skating, or swimming if the disease is not controlled because always there's a risk of fall, risk of getting drowning. So these keep them away from this kind of activity. So if as a child or as a teenager you are kept away from these kind of activities, naturally you will feel ostracized, right?
Right.
So that stigma is playing a part, and that will cause dysthymia, depressive symptoms. That's quite natural.
And what is the message you would like to give to them to get over it?
This is a treatable disease. I really can't understand why people are still shy in coming forward with the disease and getting it treated. You get the appropriate treatment and get yourself cured. It's just like anything else.
Right. So it's just like you've got fever and you're just getting rid of fever.
Correct.
Right?
Maybe the treatment will be more protracted rather than the short course antibiotic therapy for fever. It will be more protracted. It may last for months or even years. But a good majority are eminently treatable. So approach a good consultant, get the right management, and get it cured. That's the best option.
Thank you so much for your words, sir. I hope our audience is completely convinced with whatever you have sent them your message. Thank you so much for your words.
Thank you. It was my pleasure too. Thank you.